Hello, my name is Victoria. And for my presentation for psychotropic medications, I have sedative hypnotics. Then this is just an overview of everything I'll be covering in the presentation. First, I'll go over the medication name, the classification, administration, any interactions, what the contraindications are, labs that you have to look at before administration, the mechanism of action and the impacted neurotransmitters, what it is used to treat, the expected outcomes, common side effects and precautions, toxic effects requiring immediate intervention, and the standardized assessment tool for tardive dyskinesia in EPS. Okay, so first, what is the medication name? Sedative hypnotic. Then I also have this quote. So short-acting benzodiazepines and benzodiazepine agonists have become the most widely prescribed sedative hypnotics because of their short to ultra-short half-life and low tendency to impair cognitive and psychomotor performance on the day following nighttime use. Since that's just an overview of the most common drug within the class, I know we're supposed to focus on the class overall. I just want to give some context. And along with that, the drug classification has two names, sedative and hypnotic. So I just wanted to differentiate between them. So sedative drugs will act better for anesthesia than the hypnotic drug. In addition, sedatives will produce a relaxing and calming effect that can be preferred to take during the daytime. On the contrary, hypnotics make patients fall asleep, so can be preferred to take during the nighttime. On to part two, the drug classification. So sedative drugs and hypnotic drugs are classified differently. For the sedative drugs, one of the main classes is benzodiazepines, which are mainly used to treat seizures, muscle spasms, and anxiety. Then here are some of the drugs that are classified under benzodiazepines, such as librium, Xanax, Ativan, Valium, Alsticon, Serac, Clonopin, and Rohypnol. And interestingly and sadly, Rohypnol is 10 times stronger than Valium, and it is sometimes used as a date-rape drug just because it gives a sedative effect. So when people give it to someone, say in a club, they won't be as aware. So it's important for everyone to be cognizant when they're out, be with a friend, and be careful of this particular drug and people who would want to harm them. Another class of sedative drugs are barbiturates, which are mainly treated for seizure disorder. Then examples are Nembutal and phenobarbital. Then there are also Z-drug sleep medications, which are using the BCI receptor, and it helps as sleep assistance, and it should not be taken for a long period of time. Some examples are Lunesta, Ambien, and Sunata. Then for the classification of hypnotic drugs, these are also known as soporific drugs, and they're used to treat sleeping illness, insomnia, and surgical anesthesia. They are also widely classified as benzodiazepines and non-benzodiazepines, and they can further be classified as 1, ultra-rapidly elimination hypnotics, 2, rapidly elimination hypnotics, 3, relatively slow elimination hypnotics, and 4, slow elimination hypnotics. Then the elimination has to do with how long the drug lasts and the half-life until it is excreted from the body. And also, it is a CNS depressant. For how it's administered, there are two main routes for administration. The first is oral, in which it is taken by the mouth, usually with a tablet, capsule, caplet, sublingual tablets that are placed under the tongue. And you can also use oral spray. Then it can also be injected either intravenously or intramuscularly. For the fourth part of the presentation, I'll go over drug-to-drug or drug-to-food interactions. So for drug-drug interactions, the FDA warns against the combined use of benzodiazepines, sedative hypnotics, with opioid cough medicines, or other drugs that depress the central nervous system. Just because both benzos and opioids have the same effect, they're slowing down the body, so when they're combined, it can be dangerous. And patients who do take these medications should be warned about risks of slowed or difficult breathing and/or sedation and the associated signs and symptoms. Because when you take these drugs, you're slowing down your system. That can be very dangerous. You could slow your respiratory rate, and if that's not closely monitored, it can lead to serious harmful effects, which I'll get into later in the presentation as well. Then also for drug to food interactions, there are herbal and grapefruit interactions with sedative hypnotics, and herbal supplements and grapefruit can have significant interactions with certain benzodiazepines. Examples of some of the more common interactions include kava, St. John's wort, and grapefruit juice. So you should likely not take any of these if you're planning on taking a sedative hypnotic. Then in the situation where there is an overdose on a benzodiazepine, which is the most common sedative hypnotic, there is an antidote available, which would be used to treat that in the hospital. Then the antidote is called flumazenil, and it's used to reverse the sedative effects of a benzodiazepine. It blocks the effects of benzodiazepines by competitive interaction at the benzodiazepine receptor site. And a patient experiencing an overdose on this drug may have the following signs and symptoms: dizziness, unresponsiveness or weakness, anxiety, agitation, or difficulty breathing. And this is just the chemical composition of flumazenil. For the contraindications, and this goes with psychiatric conditions or contraindicated drugs. Contraindicated conditions include current or previous alcohol or substance use disorder, because sedative hypnotics are very addictive, a history of overdose, fall risk, just because it does impair a person's system. Also, if the person has traumatic brain injury, memory problems, sleep apnea, if they're over the age of 60, that does correlate with fall risk, chronic obstructive pulmonary disease or PTSD. Then for the contraindicated drugs, I briefly covered this with opioids, but you should also avoid alcohol if you're planning on taking a sedative hypnotic, because alcohol also works like a sedative. So drinking and taking a sedative at the same time can combine the effects and lead to dangerous life-threatening symptoms, such as loss of consciousness or stopping breathing, which can lead to death. Then you should also not mix sedatives together or with other medications that have similar effects, because mixing these sedatives or taking them with medications that can cause drowsiness, such as antihistamines, can lead to serious side effects and possibly overdose. Then you should also not take or smoke marijuana, because using marijuana may reduce the effects of sedatives, particularly with the sedatives used for anesthesia. Then the labs you should check before administration. I have a diagram here. It's when you take the blood in the hospital. Before, you should collect the complete blood count, look at all the different levels. You could also do arterial blood flow sampling, check your glucose level, and do a chemistry and toxicology screening. Then before administration and when screening for toxicity, test alcohol, salicylate, acetaminophen, and quantitative serum drug concentrations. Just because sedative hypnotics can have serious effects, it's important to know what's going on in a person's body before they give them another drug, as should be the case with all drugs. Then next, I'll cover mechanism of action and the impacted neurotransmitters. For the mechanism of action, this drug suppresses the limbic system of the brain, which determines emotion and behavior. It can also alter the reticular formation, which regulates sleep and consciousness. The neurotransmitters that are affected are mainly GABA, and neurotransmitters act by releasing